question going into the future that is defined within the NDP and that is defined within the context of the NHI is, how do we make sure that we deliver quality healthcare that is accessible and that is at a lower cost that adds value to our patients?
And there's two things that inform quality. Firstly is the attitude of our staff. It's something that we really have to work on those, and that's why we continuously work very hard to discipline those who are found to be doing this wrong thing. We're spending more than other countries who are far smaller than us, but simply because there's a big component of the private sector and a small component in the public sector, which serves a lot of population. However, even in the public sector, the important thing there is also to continue to want to look for efficient ways of delivering services.
If we look at the private sector, there are equally significant problems of efficiency and quality, but they're different. The one is that the way the private sector is set up it leads to waste. It leads to over-servicing, too many cesarean sections, too many spinal surgeries, too many angiograms, because that's how the system makes more money. Every part of private healthcare is fragmented from every other part. So doctors work independently from the hospitals, from radiology, from pathology. Every specialist is a one man or one woman shop, and the experience for patients is very unpleasant because you go from one place to the other, and it's inefficient because tests get duplicated, and the quality can suffer because information doesn't flow. Having said that, I think the baseline level is excellent, but there is a huge amount of efficiency gains that could be achieved, and as I hope we'll talk about, information technology is the key to much of that.
One of the staggering statistics that I found is that if we look at the proportion of obese individuals that are admitted into hospital, it's really concerning, with close to 25% of females who are admitted into hospital being obese, with males just under 10%. So if we can educate our population through gamification, technology and so forth to understand what's happening to their health from a smoking point of view, exercise and diet, we'd hopefully be able to ensure that for each rand we have, we are able to address those in need in a far more effective manner, rather than trying to cure diseases that we've caused by our own doing.
And I just want to bring you in here, Mohammed, and just give us a feel of, one, we're sitting in an e-government conference. What exactly is the correct understanding of e-health and e-government?
E-government means something very simple. E-government means make change happen fast. The same technology that drives the social networks that we're dependent on, like Facebook and Twitter, how do we use this same technology and innovation to make a difference in people's lives? So I'd like to take a moment to tell you about, I think, probably the most inspirational piece of work that I've done in my professional career, which is actually thanks to MEC who made the piece of work happen. The challenge that was set forth was to solve one of the problems facing Gauteng Health, which you're probably aware of. And the question was, how can technology help? And so this picture kind of illustrates the problem. In some cases, people can wait 12 hours to be assigned a bed. Guys, if we had to put a TV in casualty, what would this TV display? And this is the actual sketch that we did that day. I was too lazy to write it down, so I took a picture of it, much better. So I went away that night and I played with all of these tools that we often always talk about. I built a database in Google Sheets, I built a front end in Clipfolio, and I took a Raspberry Pi and converted it into a display unit. This solution, which took about 24 hours and cost less than 5,000 Rand, has served the hospital for over 3.5 months now.
Information technology is purely an enabler. It is going to give us information that will help us manage healthcare, but it's not going to solve the problem. The way healthcare is delivered in South Africa is, both in the public and the private sector, is curative. curative is a highly expensive process, and it's highly expensive because you treat the patient for the condition they've developed. We need to be far more aggressive in a promotive and preventive healthcare programs. It's also more cost effective, and certainly we can start using information technology at that level. Because we have a shortage of human resources, we should start considering telemedicine as a process to communicate between outreached areas, rural areas and central areas.
We know what systems is applicable to what province. On the basis of that, one of the things that has been agreed to in our MINMEC, which is Minister MEC's 9 MECs of Health, is to go with systems that are going to enable us to get interoperability.
Do we actually have the right strategy for deploying technology in healthcare? What is your view about arriving at a single patient record? How do we get there?
If I have a single patient record, I'm the custodian of my own record. It's not my doctor anymore. I go on holiday and I need to go and see a doctor. So how would the other doctor then have access to my record? There's also the protection of personal information. So it's up to me to assign access to that doctor, and I could assign access, say, from 10 o'clock to 12 o'clock. And when I see the doctor, he would have had access to my record already to get some background on my history, on my medical history. We need to consider converged technologies. And having said that, you go for an MRI scan. You can get the scan or the images on CD. Why not just put those images directly onto the back-end system? It's linked to your single patient record, and you have access to those images anywhere, anytime. When you look at the proliferation of smart devices, whether it's smartphones, tablets, laptops, as long as you have connectivity, you will have access to your records. And I think this is where Telkom, with a whole new ICT and converged technology approach, can play a major part in the new way of e-health and the new approach to e-health.
What are the trends and what is the thought process that we should be having as a country to actually drive this agenda properly?
We need a set of solutions that the workforce is actually enabled, they feel empowered, and it actually monitors their performance. But also, the old systems don't allow the workforce to collaborate around a particular patient, okay? So what they will do is they will do what they've been taught to do, and they will follow a very strict regime, very strict process. In the new world, as the MEC stated, okay, Mediclinic, that's another one of our customers, what they do is they empower the workforce to get a better understanding of the actual patient's diagnosis. They have the ability to collaborate with other specialists on this particular patient, okay? And more important, even the patient can collaborate with other patients that are going through a similar treatment so that they can understand and support each other.
Now, I wouldn't sit here and purport that every doctor, every nurse is willing to embrace the system. But I can say with authority the doctors I've spoken to, whether it's Chrisane Baragwanath or Charlotte Matlege or Tambo Memorial, and some of them are senior doctors, some of them are junior doctors. They love and are yearning to see the system working every day.
If you go to a doctor's office in the private sector or a private hospital, the records are still paper. So we have digital data only because we get electronic claims, but the claims are not the same as the patient record. So, I think it's a good moment to stop and say, contrary to what the average person thinks out there, this is an example of where the public sector is moving ahead.
People who've got expertise, I know nothing about health, by the way. What I know is that patients must be treated with care, doctors must be looked after, nurses must be looked after, hospitals must be clean, and all of those things. Those are my parameters of operation. But what I expect doctors to do, to tell me what medication, what equipment they want, what in this and this they want, they give us a proper specification, not what they prefer as individual.
How have you as McKinsey succeeded in the socialization of these technological initiatives you've deployed in the province?
You can work together with the staff at the hospital to design the software. And if you've got 10,000 people, you can create forums, people can vote, people can use WhatsApp and say, this is the feature that I want. What's this priority one feature? You spoke about 5 priority features. What's the priority one feature? We let everyone vote on it, and that's the way we socialize, because then we come together as a community and we agree this is the number one problem that this software must solve.
What we need to do is to start using the technology to understand the patient before they get ill. And the role of medicine, in my opinion, is to prevent people getting ill.
Often, people would think that technology is the answer to all our problems. But actually, as mentioned by a number of you, is that if we don't have a clear strategy and actually understand what the real challenges are without skirting around some of the issues, a system will be built that will just not work.
We need a shared clinical record, okay, and it needs to be based on standards. And we need to understand how we're going to integrate that with the new national ID.
The clinic must be linked to the district, the CHCs must be linked to the district hospitals, and so forth. So this thing of having clinics that are separate from this and that, it just doesn't help anybody. We are making the patient to suffer. If a patient's record is linked from a household where the community health worker is, we are in a position to have the journey of the patient much smoother than the things are at the moment. And I really want to appeal that let us work together and collaborate. Let us stop wasting resources where we can collaborate and save resources much, much better.
Now, I do believe that the leadership in public and private needs to be talking to each other now, if we're going to get onto that high road. Otherwise, I think the default is we'll end up on the low road, each doing our own thing. We'll probably do a good job, each on our own, but as a system, we will have failed our stakeholders.
I think Internet of Things create a huge opportunity. There was mention made about 2 ambulances going to the same street. Now with Internet of Things, what if you can put that patient record in the hands of the person operating the ambulance?
Department of Health nationally has rolled out a TV channel which is going to be unveiled on the 1st of December this year. That is going to be run 24 hours, providing all sorts of kind of information. But we have to work together.
There actually is no conversation about healthcare that sits in this one little corner called the public sector or this one little corner called the private sector. There's a cross conversation that needs to be had in that context, so that the vision that is articulated in the NDP, which is unapologetic about what it is that we seek to create as a country, is then realized by both parties. And I think in a roundabout way, I think that is the summary of what it is that we should be doing as different players within healthcare. Thank you.